Biosphere Strategy by Mackenzie Skogstad. Environmental self-care. This category of self-care surrounds creating work and home spaces that make you feel at peace, inspired, grounded, and just plainly happy. Beyond aspects of decorating your environment, this idea of self-care supports a tidy space that allows you to be efficient and comfortable, but personalized to your needs. Techniques in action. Setting up timers to complete a task or just doing a quick pickup. This is by no means means that you need to clean everything, that your space is not right unless you have it as sterile and put together as possible. This really just pertains to cleaning up little things to make your day easier, to make you more comfortable. So if you set a timer for 5 minutes, you clean out a drawer or you clean out your purse. If you want to just do one closet, it's whatever's going to make your space feel more comfortable and less distracting. It's really important when we think about how to control our environment and how it will help us feel is we think about light and the quality of air. Keeping your windows open, getting some fresh air into a stuffy room, allowing that natural light in, not sitting in a dark cave being sad, that's going to help support your mind to be productive. It's going to help your energy levels. It's going to feel more natural and more comfortable to be a participant in your life, and it also helps you just be aware of your space, which also instills a sense of mindfulness. Laying out your clothes or your morning skincare routine. It doesn't have to be a situation where everything's put away. It can just be that things are put in places that are useful to you. Your environment should be helpful in your life experience. It should support you and it should make you feel good. So if I don't like mornings, I'm going to lay my clothes out. If I forget to do my skincare, I'm going to create an environment that helps me remember by laying it out on my counter. And as much as that is, physical self-care acts, it also pertains to how you're helping your environment participate in that self-care. Using candles, incense, diffusers to make your space more enjoyable. Olfactory senses are incredibly strong. They connect with memory, they connect with mood. There's so many ways that we can help our sense of smell create a better environment, happier moods, just senses of comfort. Rearranging your room or your desk space to decrease distractions. This means that I'm not going to have a desk covered in paper so that I'm looking at everything else other than what I'm actually working on. It's going to help me create a space where I do my homework that doesn't have the TV pointed at it, that helps me remember to do my reading first. Whatever it is that creates that environment, you want to set it up for yourself. Your room doesn't have to make sense to anyone but you. Your desk doesn't need to make sense to anyone but you, but you need to find a way that helps you work best and feel the most grounded and mindful in the tasks that you're doing. This is supported by Dr. Potter at the Cleveland Clinic, Stanford University, and the World Health Organization. Concept origins. When we talk about the concept of cleanliness in correlation to health, one of the foremost leaders in that is Florence Nightingale, who is famously, part of the concept of being clean and being aware of germs and treating patients well. She definitely had some pretty rough political views that we are no longer accepting of in this age, but we can absolutely acknowledge that she was correct in the desire to create healing environments for patients. That means clean linens, that means clean bodies, that means fresh air, that means safe food, that means a concept of comfort. Those are aspects that even back in, I believe, the Civil War era, she was instigating healing and a better patient environment that we now correlate to a general better mental health environment. Professional support. So the idea of spaces that create a sense of connection, comfort, safety are pretty obviously well supported in most practitioners. The main resources that I used were the Cleveland Clinic and Stanford University, and the World Health Organization, but the litany of various mental health professionals put out posts that discuss how they practice environmental self-care within their space and how they help people support finding ways to personalize their experience in their environment. And whether that's decorating or rearranging or keeping a space tidy, being okay with certain types of messes, whatever that is, it pertains to the person. And this is pretty well supported. We also think about things like lighting and the concept of like colors and stuff like that. There's many theories that follow along with that, but acknowledge that we absolutely have emotional responses to our environment, whether that is with colors or decorations or lighting or just general like creature comforts. If you like fuzzy blankets, you should have fuzzy blankets. If you do not like them, you should not have them. You should have linens. But these are all ways that we can acknowledge identity and preference, and that is well supported within most of the mental health professions. This is per Dr. Porter and Stanford University. This is not to be confused with morality. There's historical evidence that supports this idea that we kind of correlate cleanliness with purity and with really, really stark and harsh examples and expectations. This is supposed to be about your desire for your environment, what you want your environment to be for you. Do you want a peaceful space? Do you want an inspiring space? Do you want a space that has a little chaos but also has some very strict organization aspects? Nothing is wrong unless it's not working. That is the biggest focus of environmental self-care. You are creating a space that works for you, that helps support you be a good person, a person who can do things, a person who's productive, a person who feels good in their space, who absolutely connects and grounds themselves. All right. So when we talk about environmental self-care, let's talk about mindful space. Now, when we talk about mindfulness, it is a connection, it is being present and aware. So when we add that to the context of space, a mindful space is a place where you feel connected to it, you feel safe within it. It is a place where you can be creative as much as a place where you can rest and be comfortable. Environmental cleanliness, again, this is another way that we exemplify how it's personalized. Your cleanliness is based on your desires and your needs. You keep things tidy, that's great. You like your laundry on the floor, but you make sure that your nightstand is clear so it doesn't bother you when you try to sleep. Wonderful. That is environmental cleanliness. Full support from me. Next, let's talk about chromotherapy, also known as color therapy or color theory. It's just the acknowledgement that there is absolutely human interaction between lighting and perception of color and, vividness and hues, and those can all affect our moods and how we perceive a space and how we perceive a situation. There is privilege involved in environmental self-care that should be acknowledged. There is no way to say that environmental self-care does not surround having a space that you can control. People who experience or people who are unhoused do not always have that option, and it's important to acknowledge that. But also, environmental cleanliness or environmental self-care revolves around safety. So if you don't have access to clean water, you don't have that privilege. Even if it should be a right, it is a privilege in the way that it is not encompassing all fellow beings. There's plenty of times where people do not have money to decorate. They cannot paint because they rent. There's a lot of energy involved in rearranging and thinking about your space. And if you do not have the ability to do that in that moment, it's a privilege when other people do. It's okay to acknowledge how self-care can be privileged as much as acknowledge where we can accommodate the lack of privilege. Color therapy. So this is a practice dating back to the ancient Egypts, using color and light to heal physical and mental ailments, chakras, and this is considered a holistic medicine, but it's widely practiced. In current age, like treatments with blue and red lights are studied and to treat things like high blood pressure and depression. I mean, people have heard of happy lights all the time. We want to influence our environment to create the happy feelings within us. And that is by accessing natural light, turning lights on, lighting candles. That's by surrounding yourselves in colors that feel good. When we talk about Indian philosophy, we talk about chakras. And these are considered spiritual centers of the body, right? There's 7 chakras. The root chakra is located at the base of your spine and it is red. It has a lot to do with our connection to earth. So when we think about red clay, red dirt, it's vivid, it's bright, it's real. Then we can talk about the sacral chakra, which is orange, and that's located about 2 to 3 inches below the navel. This chakra is associated with reproduction, and it is the mind-body chakra. So, physical pleasures, emotional pleasures. There's definitely aspects of physical health too, like the kidney and adrenal glands are connected to that area. The solar plexus chakra is associated with the color yellow, and that is going to be located between the navel and the sternum, so like that base of your chest, your rib cage, and it's about empowerment and well-being. That theory of like gut feeling and that identity and that intuition and that's strong in there, and that's yellow. The heart chakra is generally associated with green, and we usually connect that, or pardon me, Indian philosophy connects that to mental focus, compassion, empowerment. When we think about green, we think about natural, things like that. The next chakra we'll talk about is associated with the thyroid and metabolism, and that's going to be blue. It's to express, peacefulness. It's another one where we talk about hospital blue as a color. We all know off the top of our head that very much is connected to how we perceive it. It's clean, it's, kind of sterile, but kind of comfortable. Indigo color, that is the third eye chakra located between the eyebrows. That influences our clarity and wisdom and self-esteem. Then we have our crown chakra, which is usually correlated with the violet color. It's associated with dreams and spirituality and light sensitivity. So, color therapy has positive and negative effects. Like we've talked about, the color hospital blue. I mention it all the time as a person who works in the care field. It's pretty common, but it's fun and it's also safe. And then there's aspects that we also need to be aware of. Flashing lights are not safe for people with epilepsy. That is okay to acknowledge, as much as flashing lights are super fun at a dance party and they do ignite a certain amount of energy. You just need it to be appropriate to the context you're using it. Color therapy can be really productive, and there is research that supports its usefulness. And we want to apply that to our environments. So next, I call this the 5-minute dash. We're not going to do this together, but I will ask you to go ahead and hook up your phone, set a 5-minute timer, pick a area or a item that you want to clean out, and before you do it, you're going to think about how you feel about it. After you do it, reflect, think about how you feel differently about it now that the task is over. Think about your experience of getting it done. Think about how it felt to hear that alarm. Think about what you wanted to do after that alarm was done and you had this nice clean thing. It's not to make you feel like you need to do things. It's to make you realize that sometimes doing things makes you feel better, even if you didn't want to do them. Also, it's another way that you can enjoy your environment. If you like to look at something put together, this is going to help. Environmental self-care is all about personalization, supporting how you feel, and making the environment create a better space for you to thrive. These are my resources. Thank you.